everybody, it's Dr. Chloe. Today I wanted to make a video for you guys on a topic that I get tons of questions about, and that's acupuncture. So I get questions all the time such as, what is acupuncture? How does it work? Does it hurt? All sorts of things. So I just wanted to go through some of those questions and give you guys some answers. So the first one that I get the most commonly is, what is acupuncture? How does it work? So to make a long answer relatively short, acupuncture is when you put a small thin needle into the soft tissues of the body, and it creates what we call a microtrauma. When you have a microtrauma to the tissue, it brings an increase in blood supply to that area. So with more blood supply comes more oxygen and all the different cells that our body uses for healing. Another question I get all the time is, how would an acupuncture treatment sort of look, or what takes place during that appointment? So for me, it always starts with an assessment. So I'm going to do a thorough history and physical exam to try and figure out what's going on with the patient, and then I'll give a diagnosis and determine if acupuncture would be a good treatment option for them. A lot of my patients receive chiropractic treatments such as adjustments and soft tissue therapy, as well as acupuncture. So when I have a patient who is getting acupuncture, I'll often have them laying down or just sitting in a relaxed position, and then I'll put the needles in, and they'll stay in anywhere from as short as a couple of minutes to as long as 20 to 30 minutes. It depends on the patient's complaint. Another thing that I can do is called electroacupuncture, and that's when you attach leads to the needles, so you get an electrical current running through them, and it contracts the tissue that the needles are in. The last question that I get all the time from patients is, does acupuncture hurt? So I can't give one straightforward answer because everybody is different, but what I explain to most of my patients is that you might feel a little pinch as the needle breaks through the top layer of skin, but then afterwards you don't really feel much more than that. Depending on if the tissue is really dense or hypertonic, you might feel a little bit of pressure, but most people find it relatively painless. So if you have any questions, I'm going to be doing a demonstration video that I'm going to put at the end of this so you can follow along and see what an acupuncture treatment might look like. Hey everybody, today I wanted to show you guys a demonstration video of acupuncture and what it might look like if you were actually getting a treatment done. So the needles start looking like this. They come in an individually wrapped little plastic container, so they're nice and safe. And then once you take them out of the container, they look a little bit more like this. So they're all in these little tubes, and then you take them out when you actually are going to put the needle into the patient. So I have a lovely patient like here that's been volunteered for me. So when I'm doing acupuncture, I'm going to put the needles in a couple of different locations. It could be either in an acupuncture point, or in local trigger points, or even just where a patient might be feeling some pain or have some swelling or something along that lines. So today I'm going to show you just a couple of nice and quick spots. So I'll start here. I'm going to put the tube right up against the patient's skin. I'm going to give a quick little tap of the needle, which pushes it right through the first layer of the skin. I'm going to remove the tube, and then I simply just push that needle in a little bit further. And I can go as deep or as superficial as necessary. So I'm going to show you now another point. You can go a little bit closer up towards the toes, or really anywhere depending on what the patient needs. So again, I'm just tapping that needle into the skin, and then I give it a little extra push. Good. And then lastly, I'll just show you one more point here just to give you one last example. Again, just find a spot where that patient might have a trigger point or be feeling sore, push that needle in, give a little extra push, and there you go. So that's just a really quick example of something I might do with an acupuncture patient. If you have any questions about whether or not acupuncture is right for you, feel free to just ask away. You can message me, email me, or comment on this post, and I'll answer as best as I can. See you guys later.